I am Dr. Ashwin Dalal. I head the Diagnostics Division of Center for DNA Fingerprinting and Diagnostics in Hyderabad. We deal with diagnostics, prenatal diagnostics and therapy as well as research in rare genetic diseases. So, genetic testing is used for finding the genetic cause of a disease in a particular patient. Traditionally, we have been using various techniques like Sanger sequencing or karyotyping. Although these technologies are very useful in finding the cause, their yield is very low. So, whenever we do testing using these methods, we find the cause of disease in very low percentage of cases. Like karyotyping, the yield will be about 5 to 8%. However, with the advent of the high throughput technologies like the next generation sequencing and the microarrays, the yield of genetic testing and diagnosis has increased tremendously. When we do a microarray in a patient with intellectual disability or autism or congenital abnormality, the yield goes up to about 20%. So, this is a very large yield of diagnostics which is helping us to identify the cause of genetic disease in the patient, and then it helps us in deciding therapy, management as well as doing prenatal diagnosis for prevention of birth of another child in the same family. We have had lots of experiences where the genetic diagnosis coming out of the next generation sequencing or microarrays have helped the families to plan for their next child so that the same disease does not recur in their family. So, in reproductive health, we either have the pregnant mother or mothers to be who come to us before pregnancy. So, when a couple comes to us before pregnancy and they want to know whether they are at risk of having a child with abnormality, in such cases we can do carrier screening in these parents to look if they are carriers for some disease causing variants. If two carriers marry, then there is a chance that their child will be affected. So, whenever we do carrier screening using either next generation sequencing and we identify that both parents are carriers of mutation in the same gene, then we can do prenatal diagnosis to prevent birth of such a child. Sometimes the couples are not interested in doing abortion after a prenatal diagnosis, and in such cases we can use the method of in vitro fertilization followed by pre-implantation genetic diagnosis, so that only the healthy embryos who do not carry the mutation can be implanted and the couple can have a healthy pregnancy. High throughput technologies are being used a lot in diagnostics. The main use of these technologies will be when they are used in preventing birth of children with various genetic diseases. And this prevention can be done through various methods like non-invasive prenatal testing or by doing carrier screening in the couples. So, in the future we think that these technologies, when they are applied even before planning for a pregnancy, like doing carrier screening in the couples to detect any mutations which they are likely to pass on to their children, or by using non-invasive prenatal testing during the pregnancy, will lead to better outcomes in many of these families, so that we do not even have the first child who is born with a genetic disease.